Father, today
Yeah,
today Nimi Chechi is there with us.
where is she? Where is she?
Yeah. Nimi Chechi.
Where is she?
Good, good
She joined.
afternoon, sir.
Nimi, oh, okay, I can't see you.
I
Welcome back.
Thank you, sir.
Yes, after a long time.
Yes, because just now I
Yes.
finished duty, then I saw the YouTube, so I decided to
Okay.
join here.
New admins, if you don't know, she was a long time admin here, very active admin. Yes.
Hi,
And
ma'am.
now,
Good evening, ma'am.
Good, good evening.
Good evening.
yes. Are we on live? Just
yes, Acha.
yes. Yes. Good afternoon, good morning, good evening. Just mention if you have reserved the slots, we'll give you the link to join. Yes. I'm posting the link. If you have reserved, just mention you have reserved, okay? Then you can join here. You have to mention you have reserved the Zoom slot. Then only the admins will be able to identify you. Hi, good evening, good afternoon. Join soon. We'll begin soon. Yes. I've posted the Zoom link. Those of you who reserve the seats can join, but see that you use two instruments. Keep signed into YouTube, because if you lose connection or go by technical issues, if you go out of the classroom, we'll not be able to admit you in between the session. Okay, so keep connected to the YouTube as well. Yes, that's great. Yeah, just type in if you have some concerns.
Good evening, Father.
Good evening.
Good evening, Father.
Very good evening. Very good evening. Is there a delay like last time, or yes, you can type in if you have any concerns. We'll be beginning in 2 minutes. We'll end the admissions in 2 minutes. Those of you have to mention there at YouTube comment space, you have reserved your slot, then admins will be able to admit you. Otherwise, if you come to the waiting room, they will not be able to admit you. Please mention if you have reserved your slots. Sarah Gill, reserved, yes. Elise, I am attending guest Zoom, yes. Yeah, those who are attending here, just type in I am attending at Zoom at the YouTube comment space. I can't see the chat here in the Zoom. So you have to chat at YouTube comment space and mute your audio and unmute your video. Those are in the Zoom classroom. And only when you enter, yeah, there is some audio on and some
Good evening,
distractions.
Father.
Very good evening. You want to enter? Good evening. Yes, yes. Zoom user iPhone. Yeah, Zoom user iPhone and all. You should mention your name. Otherwise, just mention. If you don't know if you're a newcomer, you can just mention at YouTube comment space. You don't know what is your name or what is the instrument that you're using. I am joining Zoom live. Jyoti didn't test the race. I'm in waiting. If you have you mentioned, have you reserved the slot to be Sapo? Those of you who have not reserved the slot at the Zoom classroom, if slots are available, we may admit you after the first segment, okay? Those who have reserved slots earlier, please mention you have reserved the Zoom classroom. Yes, everyone, welcome. Yes. Joey, we have a Zoom user. Have you reserved your slot? Tulani, you haven't reserved your slot, right? You are supposed to reserve your slot. Otherwise, next time you can. Otherwise, after first 15 minutes, we'll admit you if the slots are available, okay?
Yeah, good evening,
Good
Father.
evening, Nina. Yes. I'm from Bangalore, yes. Waiting to join Sarah Gill can be admitted, I believe. Is she waiting in the waiting room? Sarah is not seen in the waiting room.
No, sir.
Yes, you aren't in the waiting room, huh? For my exams is next week, yes. Yeah, if you know EduSkills, you know there is no much meaning in saying my exams at next week, because the principle at EduSkills is to book the exam date after gaining competency. Yes. There are no shortcuts that we can give you. Only by practice you can gain competency. Yes, in spite of 1 week notice and repeated notices, there are hardly 50 people in altogether. Yes, if you have any concerns, you can type in. Wanted to join but wouldn't manage how to book the slot in Zoom. So, Harali, you have to mention the Zoom YouTube link will be given in advance. This was given last Thursday, not last Wednesday. So you are supposed to mention there you'd like to attend Zoom session. Those are the names collected by the admins that they admit. It's okay, next time you can do, otherwise after the first segment you can join us. Okay, after 20 minutes. How to join, please? Yeah, that's what I'm explaining. You have to book in advance. Okay. At YouTube comment space, live comment space. We have been giving you notices more than 20 times, repeatedly posted in all the groups. Yes. Nini, are you here in Kerala? No.
No, it's next month. We will
Okay.
meet there.
Okay, okay. Yes. Yes. And you want to give some advice?
Just
Some suggestions?
It's after a long time, Father. So
Yeah.
I
No,
hope they all are good. They are studying, following our rules.
yeah. We can speak nothing about the module, but then in general about the platform or how to use it or how to follow.
This one I want to say one thing, because this is not only for the OET. This will help for your future, because don't think about this is for my OET
reason
exam I am
purpose tag.
writing. In your future, whenever you are going to the other countries, if you have planned to study or anything. So this learning, what you learned from here, what father taught you, it will help you a lot, because I have personal experience. I had done a course in the international university. So whatever the assignment and everything, what I wrote, it's all from the EduSkill platform. That's why I wasn't confused how to write. I asked your father how to, then father told me this one in our reading part 3, what is written there. That is for your assignment, how to write and the connection words. Then I had many, then after that also I go for my NCLEX. There also they will teach me for the absolute words, how to you approach
Mummy.
your exams, absolute. So if there is absolute for the elimination strategies, this all when they are telling to me. So always I remember, father, this all in the EduSkill platform I learned from there. So it was easy for me. So everybody, you are in a good platform. So this for your lifetime achievement when you are with the father. So maybe now you will not think, after when you are pass your OET, you reach your dream destination, that time you can understood what I said to you. And of course, everybody will go to higher educations and everything. That time you know what father teacher, how the each paragraph, how explained it. So this is everybody just follow what father is saying with the consistent practice. The consistent practice will give you a bright future and your success. And don't make in a hurry, because as I heard before, my exam I already booked. So there is nothing to do for if you booked your exam. It's better don't book your exam until you competent, then book the exam and go and write. You will definitely, all of you will pass.
Thank you, Nimi.
Thank you.
And let's let's begin, and we'll have a minute silent prayer. So once again, good evening and welcome to EduSkills OET Made Easy. Our mission is to make you fall in love with OET. If you're watching this on YouTube, kindly consider subscribing to the channel. Give us a thumbs up if you like our work, and share to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially and emotionally struggling to crack OET. Hope I am audible and visible. Just put an yes or some hearts at YouTube comment space if I am audible and visible to you. Yeah. Let me have a heart or a smile or say yes. Yes, please. Further, could you repost the reading session sequentially to the page? It's OET Reading Part A, Basic and Advanced, etc. Yeah, we are trying. You have to help us because a lot of work is there. Now this is step by step. We are posting and giving you tasks one by one. Once we complete this program, everything will be in a sequence. It's number 1, 2, 3 to 100. Okay. And whatever I'm going through here, it's step by step. Whether I give you listening or reading or speaking or writing, it's all for all the 4 subtests. So don't think when I give you listening, it's only for listening. The listening practice you have done well, you will realize when we go on taking some sessions for reading, how it's useful. Ultimately, you need competency in language. Okay. Are we ready to go? Yes, there are so many S's. Yes. Everybody, yeah. Yeah, if you have not liked, just click the like button. If you like EduSkills, click the like button, and the more messages you send there in the comment space, we will be able to reach more people. We are hardly 44 now. And to previous 2 batches were stopped in between because there were not sufficient learners. This one we have been postponing the session. This is the third day postponement of this session. In spite of that, there are only 44 people attending it. And the thing is that next time some other 20 people will come and join. And 20 who are here will not be there for the next session. That's the problem. Yes, let's begin. Let me share my screen. Just let me know at YouTube comment space when you see my screen, the PPT, if the slides are seen to you. My system is a bit old, so it's taking some time teaching me patience. Should have been teaching you patience, but it is teaching me patience. That's the problem. Okay. This Occupational English Test, OET Skills. Specifically, we will be dealing with reading skills today. And this is one of the questions that we have been discussing in the platform, in the main platform, in some of the batches. Okay, I wanted to show you something different than you were discussing. Yeah. In paragraph 6, what does the writer suggest about research into bipolar depression management? What are the hedging words or keywords in the question stem? Those who are at YouTube can post, just type in the comment space. Those who are at Zoom, if you have no background distractions, you can just shout out here.
Writer suggest.
Writer suggest. Okay, writer suggest.
About bipolar depression.
Bipolar depression.
Bipolar depression management.
My system is troubling me. Okay. Writer suggest.
About
It's taking time. About
bipolar depression.
Bipolar depression.
about research into bipolar or bipolar disorder, whichever you want to highlight is cool. Yeah. There is enough data to establish the best way to manage bipolar depression. What are the hedging words?
Best way establish.
To manage.
Yeah, managing bipolar depression is the main theme, right? So you need not highlight that probably. That's the main theme. Should be common. Yeah, and that is
data to establish.
Enough data. Okay,
Enough
I'm not
data.
able to highlight because my highlight system is very slow. You can highlight in your this one. Enough data. Yes. It's not taking. To establish the best way. Yes, enough data. Then what else? Just highlight in your copy or wherever you are using it, the second instrument. Okay. I'm not able to highlight it. Okay. Yeah.
Has not provided the evidence. Has not provided the
Yeah,
evidence.
to establish the best way to manage bipolar system. Option B, research hasn't provided the evidence for an ideal management plan yet.
Hasn't provided.
Hasn't provided
Hasn't provided the evidence.
evidence. Difficult to collect the
Okay.
data.
And C, a lack of patience with the condition makes it difficult to collect data on its
Difficult to
management.
collect the data.
Difficult to collect
Data. Oh, sorry. I was supposed to highlight here. My highlight is not working properly, so it's one there. Difficult to collect data. Don't worry about my highlights. That's not functioning. Okay, my highlight.
studies and
System is very slow. Okay. Too few studies have investigated the most effective ways to manage this condition.
Most
Few
effective.
Too few studies. Few
studies.
have investigated.
Studies.
Okay. Okay, you highlight. Okay, I can't highlight here.
Most effective.
Most effective is.
There is something going wrong. Most effective ways to
Yes.
manage. Okay. Do you have anything to say about this?
most is about question.
Hmm? What is it speaking about?
Bipolar depression.
Bipolar depression management.
Bipolar depression management.
Not exactly.
Research.
It's speaking
Research.
about research.
Research into.
Yeah, research is important. Right?
Yes,
About
ma'am.
research.
Yeah.
Father.
What does the
About
research say? Not exactly about bipolar depression, but research into bipolar depression. The study. Okay. First one says there is enough data to establish the best way. I have taken up this because there have been some discussions in the platform, but you haven't reached the real strategies. Okay. Now there is enough data to establish the best way to manage bipolar depression. Research hasn't provided the evidence. Okay. Is there anything special you can read through these two options?
Father,
Strong
these two
data
opposites.
on how to manage bipolar
Two
depression are
opposites.
surprisingly lacking. Has not provided the evidence.
Are they the straight opposite? First one A and B.
There is enough
Yes.
data here.
A and B are opposites. The first one says there is
Opposite.
enough data. Research has given enough data.
Enough data.
Second one says research hasn't provided the evidence.
Provided
Evidence.
There is no evidence. The other one says 100% evidence. This one says no evidence.
No
So they
evidence.
are quite
Two
opposites, right?
Yes.
Opposites.
So what is the implication?
Either one of
them will be the
answer.
answer. One of them will be the answer.
Yeah, what does it mean?
Other two can be eliminated.
Others can eliminate.
Other two can be immediately eliminated. So your business is so easy. Okay. Other two are eliminated. I am not able to eliminate because of some problem with my computer. This old friend of mine is not cooperating with me. Yeah. Eliminate this.
B answer.
Yes, these two options are eliminated. So in Malayalam, they call it Kutetan principle. Okay. Two options are eliminated. Cool. Then only two are left. Now you have to find out which is the right one. Who could, somebody can read this passage, paragraph?
Another particularly problematic and well-known form of depression is that which occur in the context of bipolar disorder. Firm data on how best to manage bipolar depression is surprisingly lacking. It is
What
clear
does it
that
mean?
treatments such as
Sorry. What does it mean? Firm data on how best to manage bipolar depression is surprisingly
There
lacking.
is no evidence.
Research.
there is no data.
B.
Is it there is no data?
Surprisingly lacking.
Okay, it is continue reading. Continue reading.
It is clear that treatments such as unopposed antidepressants can make matters a lot worse, with the potential for induction of mania and mood cycle acceleration. However, certain medications, notably some mood stabilizers and typical antipsychotics, can alleviate much of the suffering associated with bipolar depression. Specialist psychiatric input is often required to achieve the best pharmacological approach. For people with bipolar disorder, psychological techniques and long-term planning can help prevent replace. Family education and support is also an important consideration.
Okay, so what is the meaning? Firm data on how best to manage bipolar depression is surprisingly lacking. What does it mean? Then rest of the things are just explanation of the same.
The evidence is doesn't provide sufficient as evidence.
Which option?
They doesn't have proper data to manage bipolar depression. It gives surprisingly lacking.
So which is the answer?
B.
Research
B
has
answer.
been provided.
For that,
The evidence
Provided.
entitlement.
So what I mean, when you are discussing in detail, it's okay. In the initial stage, you can discuss on every sentence. You should understand why this is answer, why other things are not answer. Okay, you'll have to do all this as your homework. There is one instrument which is not muted. After speaking, please mute. If you are doing some other business, attending the class, you'll be moved away from the class. Okay, you'll never be admitted. Please be present in the classroom. Especially in the Zoom classroom, we don't appreciate. Just admins, could you check who is doing it? There is some instrument disturbing. You can see who is not muted. There's also some speaking, background speaking coming in. Okay. So you have to analyze all these things I have been telling you, not going to the answer. Answers are not at all important. But since this was being discussed in detail in the platform, in the batch group and main platform, I'm just giving you one more strategy where you can apply, which you did not find. I believe maybe you did not understand the meaning of. When there are two opposites, immediately we can eliminate the other two options. And one of those two opposites will be the right answer. So here, there is clearly given research hasn't provided. There is no P. Okay, that was a mistake. Sorry. Research hasn't provided the evidence for an ideal management plan, and that is the paraphrasing of firm data on how best to manage bipolar depression is surprisingly lacking. Okay. Is that clear? Yes, you see here, these two are opposites. One of them must be the answer. And also, if you want to, if you know the sequence of treatment, especially when we go into part A, we require this. The whole paragraph speaks about, the rest of the paragraph speaks about
Bipolar depression. Bipolar depression management.
See, first one speaks about to manage. The second sentence speaks about to manage. But after that, it is clear that treatments such as, so it's not management, it is treatments. Again, antidepressants speaks about treatment. Medication speaks about treatment. Mood stabilizers and all those things are speaking about treatments. Psychological techniques and long-term planning and family education and support. All these speaks about. The other one firmly speaks about, straight away speaks about manage. How from that on, how best to manage bipolar depression is surprisingly lacking. Anywhere else do you have that word manage or management?
Okay.
Yeah. See, option
Treatments
C.
such as
Treatments.
Yeah, treatments is not management. Okay, treatment can be a part of management, but treatment, usually your management happens after your treatment, main treatment. In that context also you can understand. If you don't get it now, don't worry. And as you go on with the paragraph structure, when we analyze, we will understand that. See, option C, a lack of patience with the condition makes it difficult to collect data on its management. What does it speak?
Patience data.
Lack of patience. Yeah, and it's not speaking about the research
Management.
into bipolar depression. They are speaking about lack of patience. And too few studies have investigated the most effective ways to manage this condition. That's also speaking about few studies, not about the research in directly about bipolar management, the depression management. So when there are two opposites, just eliminate the other two. You don't require, but you can, in the initial stages, we have to understand every bit of it. Every sentence in the text must be understood, okay? If you get confused in anything, don't worry. As you go on, you will get it, because we are not going to deal with it in detail. Just I wanted to reach you to this point where you can use the eliminator strategy when there are two opposites. Maybe one reason you did not understand the meaning of those two sentences. Okay, data and evidence, they are the synonymous expressions. Enough, assent, opposites. Is that clear? So the answer is, this is assent provided the evidence for an ideal management plan. Answer option B is the right one. And initial stages, don't worry about right answer or wrong answer, and never, ever, ever worry about your scores. You don't bother. You will just mention in the self-assessment form, but that's not your concern at all. We are not concerned what is your score. We are concerned how competent you are, how you are analyzing the whole thing. So here you see, it's slow. You'll have to be patient. Yeah. What is subject in the question stem? Bipolar depression management is the subject in the question stem. Okay, my system is slow, that's why I'm going slow. Okay, subject introduced. The first sentence introduces the subject. But another particularly problematic and well-known form of depression is that which occurs in the context of bipolar disorder, which means it's just introducing the subject. Subject is bipolar depression management. Then that is the topic sentence. Later on you will understand if you are a beginner. Second sentence is the supporting sentence which explains the topic sentence. Why it is one of particularly well-known form of depression. Firm data on how best to manage bipolar depression is surprisingly lacking. Or it's lacking. Firm data, firm evidence is lacking. Okay. So that is problem introduced, management of bipolar depression. After that, the real issue is mentioned, management of bipolar depression. Then you have treatments, antidepressants, medications. Yeah, mood stabilities, especially psychiatric input, psychological techniques, long-term planning, family education and support. All these things are directly not going into mentioning the management. That's the paragraph structure. And from day one, task 4, many have done it, and I appreciate those people who have sent me the audios, and I could not publish all. I will do it again. One or two I have published, I believe. All those explanations are correct. Okay, if I am dealing with it again, don't think that those explanations are wrong. They are perfectly right. That's why I have uploaded it. Okay. If you are not perfectly right, or if there is something wrong, when you send me the audios, I'll definitely give you the feedback. Okay. Now, this is again, I want to give you one more strategy and the easiest way to deal with day 1, task 4, elimination strategy applied. Most of you have not applied the elimination strategy when you send me the answers or when you send the answers in the platform. So just see here. What does the psychologist Molly Crossman mean when she says that the evidence is a wash? What are the heading words?
Molly Grossman.
Psychologist Molly
Crossman.
Crossman
Molly
says,
Crossman.
says
he
evidence
says,
is a wash.
Says
he says, evidence is a wash.
Evidence is
Evidence
wash.
in wash.
if you know the meaning of evidence is a wash, answer is already there. Immediately you can read and find the answer. From the 4 options, you need not apply any strategy. That's a simple English. But if you don't have that competency, that instrument is disturbing again. Should I stop sharing and come back to remove them, or admins will do that? Children are playing there and making a lot of noise. They are not interested in attending the session. Such people never ever give them admission to Zoom classroom. They can attend it. YouTube, yes, because they are disturbing everybody. Not only that, when this is being uploaded, everybody will be disturbed, whoever. Okay. And human, see here that the evidence is of no benefit to everyone. Any comment on it? Evidence is common in all the 4, okay? That's a common subject. You have to highlight evidence. What is to be highlighted?
No benefit to everyone.
No benefit is weak, but
Is convincing.
Is it absolute?
Yeah,
Yes,
everyone.
But is the meaning absolute?
No.
no for
Meaning is not absolute. So you cannot treat it as absolute. No benefit to everyone means it is beneficial for someone, right?
Yeah,
benefit.
Yeah. So that cannot be treated as absolute because meaning is not absolute. I have given you 2 exceptions when you consider absolutes. One is meaning must be absolute. The meaning of
must
that
be
option must
absolute
be
and
absolute. Second one, it's not
all
speaking
are
about opinion. Now here again it is opinion. Molly Crossman says it's opinion. So opinion, in case of opinion, you cannot consider absolute elimination. Then you have the sister. Yeah, if you cannot use absolute, you have the sister to help you, another sister. The evidence is weak.
Weak. Bad.
Okay, weak. Then that the evidence is bad.
bad,
convincing.
convincing.
The evidence is convincing. You
Convincing.
should practice reading this way, okay? When you know that the evidence, you need not read through those things to save time because time is your greatest enemy. So what you have to do, you have to just read those keywords, that's all, when such expressions are given. Do you find anything here? Among the options,
The first
any
one,
strategy could be possible.
evidence is
No
of
benefit.
Father A and C. No
A and C?
benefit and bad.
No, C doesn't, C says bad. No benefit means no benefit to everyone. I could not highlight all together. That highlighting I could not do. No benefit to everyone means there is some benefit to someone. That doesn't mean evidence is bad, right? For some people, evidence is good, it is saying. So you cannot categorically say evidence is bad. For some people. Anything else?
It's weak.
So,
Convincing.
yeah,
Convincing
weak. Evidence
for
is weak. The other one is convincing, strong.
Opposite. Two
Yeah, they are opposites. Straight opposites. One says evidence is weak. Other one says
Weak.
evidence is convincing.
Convincing.
Convincing means sure. The other one is weak.
Weak.
Okay.
Which means A and C can be
Yeah, if the
eliminated.
patient is very weak. The patient is very weak. The patient is really strong and healthy. They are opposites, right?
Yes, Father.
Yes,
When
Father.
the patient was admitted to my ward, he was really weak. But now, as he is getting discharged, he is really strong and healthy. They are opposites, right? So, what is the
Yes,
principle?
Father.
B and
Can be
D,
eliminated.
option B and D are opposites.
A and C
A
eliminated.
and C can be eliminated.
Yeah. So A and C is eliminated. I cannot eliminate because of some issue with my system. You eliminate in your this one in your hard copy if there is. You must have the hard copy, I believe. This was the previous first day task. Okay. A and C eliminated. So you have B and D. You can read that paragraph. Keep smiling, then only you will understand. Okay.
Human-animal interaction has been a subject of research for decades. Even so, the evidence is a wash, according to psychologist Molly Crossman, who conducted the review. Some studies find that the interacting with pets has benefits, others do not. Another problem is the quality of such studies. For instance, those that look at animal assisted therapy have only examined the short term impact. Also, there isn't usually a control group to compare results to in these.
Yeah. Do you need to go so much when there is a name?
No, only the name.
no for
Only go to
Yeah.
psychologist Molly Crossman.
Yeah.
So it is saying the
Even so,
evidence is a wash.
the evidence is a wash, according to Molly Crossman.
So it's weak.
Yeah. If
Weak.
you want,
Weak.
yeah, evidence is a wash means it can have us a wash is strong. And if you want more further, another problem, conduct the review. Some studies find that the interacting with pets has benefits. Others say it has no benefits. Some studies say there is one more explanation if you need to understand what is wash. Some studies say the evidence is strong. Others say weak. So some studies find that the interacting with pets has benefits. Others say do not. Others say no benefits. Some studies say there is benefit. Some studies say there is no benefit. So evidence is weak or strong?
Weak.
Convincing. Yeah, weak.
Weak, Father. Weak.
Yeah, it's weak because some are saying nurses are good. Some are saying nurses are not good. So evidence is weak to decide what are the nurses. Okay. So what is the answer?
B. B, Father.
Option. Yeah, option B.
B.
Yes. Let's set it. Yeah. Option B. And you know from the elimination strategy again, when there are two opposites, one of them is correct. Again, the same strategy. Again, the same strategy. So the answer is
B.
sorry. My system either goes fast or comes slow. Just want to show the evidence is weak. One of the 7 principles says when there are two straight opposites, One of them is right. So answer option is B. I am showing it because some of them were commenting in the YouTube comment space. They are not sure which is the final right answer. That's why I separately show now in one slide the right answer highlighted with in green color. Okay, session 2, question 3. Yeah. Elimination strategy. This was also discussed.
Father.
Yeah.
Father.
Yeah.
The spelling is wrong. Weak. Weak spellings are wrong.
Maybe typing mistake, ma. That's not the.
Okay, Father.
Yeah, that's
That's
typing
why we
mistake typos. Probably. I just copied it from the
Thank you.
platform. I don't know where is it from, and sometimes when they type or copy and paste, there'll be problems. But that's the only answer possible there. So you can't choose it for typos, grammar mistake if there are, we can find out. Okay, and this also from the platform. There are some discussions going on, so we'll just check what it is. Yeah, if surgical instruments have been used on a patient's. Oh,
No screen. Screen.
yeah. I think I will not be able to go on with this laptop. It's creating trouble always. Yeah. It's coming. Takes time. Yeah, if surgical instruments have been used, is it seen? No. At YouTube? Not yet, right?
Not visible, Father.
Yeah, Sola Sali says the previous one A must be correct. We will come back to it, okay? Once we complete, we will come back to it. Check again. Yeah, is it seen? If surgical instruments have been used on a patient suspected of having prion disease, they. What are the hedging words?
Surgical instruments.
Surgical instruments.
Okay. I can't highlight. You highlight, okay, in your copy. Yes. Then
Suspected having prion disease.
suspected of having disease. Then yeah, surgical instruments. They mean surgical instruments. So they is important. Either you can surgical instruments. If you highlight and understand they is surgical instruments, it's cool in a highlight again. Otherwise, they will have to be highlighted. Either they or surgical instruments. They means it's a reference to surgical instruments. Yes. Used on a patient suspect of a.
Yeah.
Yes. Surgical instruments have been. Am I audible? Hello?
Yes.
Yes, Father.
Yes,
First option must be routinely destroyed as they cannot be used. What are the hedging words?
Must is a modal verb.
Okay.
Routinely destroyed.
Destroyed.
Okay.
Cannot be reused.
Yeah,
Cannot
either
be
destroyed or
reused.
cannot be reused. Yeah, cannot be reused. Must be.
Cannot be reused.
Yeah. Second one, option B, may be used on other
May be
patients
used.
provided the condition has been ruled out.
Maybe.
May be used.
May be used.
So
Yeah,
condition
may
has
be
been
used.
ruled out.
Yeah, if the condition has been ruled out.
Ruled out. Yeah.
It can be used on other patients should be decontaminated in a particular way before use with other patients.
Should be decontaminated.
Should be decontaminated. So here the subject concept-based hedging word here it is. Other patients, provided the condition has been ruled out. Here decontamination before use with other patients. Here condition must be ruled out. Here decontamination must be done. Okay, option C. Option B is the condition must be ruled out. A is must be routinely destroyed as they cannot be used. Okay, just read the passage.
Guidelines: invasive clinical procedures in patients with suspected prion disease. It is essential that patients suspected of suffering from prion disease are identified prior to any surgical procedure. Failure to do so may result in exposure of individuals on whom any surgical equipment is subsequently used. Prions are inherently resistant to commonly used disinfectants and methods of sterilization. This means that there is a possibility of transmission of prion disease to another patient, even after apparently effective methods of decontamination or sterilization have been used. For this reason, it may be necessary to destroy instruments after use on such a patient or to quarantine the instrument until the diagnosis is either confirmed or an alternative diagnosis is established. In any case, the instruments can be used for the same patient on another occasion if necessary.
Okay, any idea? First one must be routinely destroyed as they cannot be used.
No, they are not telling so. It can be used for the patient on another occasion.
Okay, here it says it may be necessary to destroy instruments. Maybe and must be, are they same?
No, Father.
Yeah. So if there are beginners, you may not understand. They are different model verbs. So immediately, if it's saying here must be, here it is saying maybe. Not only that, in any case, the instruments can be used for the same patient on another occasion if necessary. But the option A says must be routinely destroyed as they cannot be reused. Cannot be reused is the opposite of it can be used for the same patient. So you need not destroy because for the same patient, you can use the same one. Okay. Any second one? The third one should be contaminated in particular way before use with other patients. Can you decontaminate and use for other patients?
No.
No, Father.
This means that there is a possibility of transmission of prion disease to other patients even after apparently effective methods of decontamination or sterilization have been used out. So you cannot use. It says even if you decontaminate or sterilize, it's going to be risky and dangerous. So A and B, C is eliminated. What is left may be used on other patients provided the conditions has been ruled out. So it is given here. Where is it? For this, yeah.
It may be necessary to destroy the instrument on such patient or to quarantine the instrument until
Or to quarantine the instrument until the diagnosis is either confirmed or an alternative diagnosis is established. If it is ruled out, okay, diagnosis, it says the patient has no disease, no prion disease, then you can use it for other patients. Contaminate it, decontaminate it, and use it. Sterilize it, use it for other patients. Is that clear?
Yes.
Yes.
All these are simple texts for medical students, medical
We can
professionals.
use one more strategy further here.
What
Cannot be used and may be used opposite to opposite. We cannot.
You can use. I am not stressing too much on it because there are some beginners. Because modal verbs we have not handled for them. Here one is must, one is may, one is should. Means first one is mandatory, second one is a
Possibility.
possibility, and third one is
Recommendation.
suggestion or recommendation. So here it must be. There is no suggestion or recommendation. We are speaking about a possibility. Can it be used in the future? That's a possibility. It's not mandatory, speaking something mandatory. You must use something or you must not use something. Okay, that's what you meant, right?
Yes, Father.
Yes,
Yes,
Father.
Those things are there, those who know it, yeah. And one more thing is that in the later on, if advanced people are there, I have told you conjunction. Whether you can understand the meaning of a conjunction or and all those fanboys. So here, maybe is mentioned here. And the answer B option, you have maybe necessary to destroy instruments after use on such a patient or to quarantine the instrument until the diagnosis is either confirmed or an alternative diagnosis is established. So or is there. They are also testing whether you have the competency to understand a conjunction when a conjunction is used in a particular sentence. Okay. So the answer is option B, may be used on other patients provided the condition has been ruled out. Session 2, section 4, elimination strategy. Yeah, again. That's it. This one question we will look into. Don't worry about the whole details, exception-based question. Because even the previous one had that taste, so we'll come. It should make sure that all work. See, must, should, can. Must, should, and can. Must, should, can. This guideline extra says that the nurse in charge must supervise the opening of the controlled drug cupboard, should make sure that all ward cupboard keys are kept together, can delegate responsibility for the cupboard keys to another ward. Is there anything in any option?
Yes, model verb. Must, should, and can.
Yeah. Other than that?
Father, in B option,
Yeah,
all
absolute.
word
B,
cupboards.
absolute.
Absolute is.
Absolute is there.
Yeah,
Absolute.
option B, that is an
All
absolute. So
absolute.
option B can be eliminated. I can't highlight, so you can eliminate. You can just write down. Should make sure that all word cupboard keys are kept together. All is an absolute. So you have to choose between must and can.
Can.
When there is says opinion, can it be must?
No, Father. Must.
No, Father.
Yeah.
Can.
If you're advanced learners, you can understand that when it says the guideline extra says. Okay. So normally says means cannot be must, mandatory. Let's see what it is. Okay. Maybe we will not just you can read, then we will go to the steps here. Maybe this text is familiar to you, but I want to show you something extra.
Medicine cupboard keys.
There is an instrument
keys
again
for-
disturbing that one instrument. Admins, are you not able to see it? Same instrument.
Can see, Father.
Otherwise, I have to stop it and go back and see. Such people should be identified and kept as spammers. We should never admit them again because they are not attending the session. They're doing some cooking or some other work. Yes, they can be in the YouTube. No problem. Like they can attend. That's why you connect it to the YouTube. Those people who are doing some cooking or kitchen work. Yes, please read.
Medicine cupboard keys. The keys for the controlled drug cupboard are responsibility of the nurse in charge. They may be passed to a...
Let's stop after each sentence, okay? The keys for the control drug cupboard are the responsibility of the nurse in charge. So in short, that sentence says keys are the responsibility of the nurse in charge. Nurse in charge is responsible for the keys. Simple. Nurse in charge is responsible for the keys. Yes.
They may be passed to a registered nurse in order for them to carry out their duties and return to the nurse in charge.
Yeah, that is within the ward. Any nurse in charge can hand it over to any registered nurse to carry out their duty within the ward. Okay. Yes.
If the keys for the controlled drug cupboard go missing, the locks must be changed and pharmacy informed and an incident form completed.
Yeah, if the keys are missing, 1, 2, 3 things must be done. Yes.
The controlled drug cupboard keys should be kept separately from the main body of keys.
Yeah, those keys should be separately kept. Yes.
Apart from in exceptional circumstances, the keys should not leave the ward or department.
Okay. Apart from in exceptional circumstances, the keys should not leave the ward or department. Means in exceptional circumstances, keys can leave the ward. Can be given to some other ward. In exceptional cases. Okay. If necessary.
Okay. If necessary, the nurse in charge should arrange for the keys to be held in a neighboring ward or department by the nurse in charge there.
Yeah. So this is called exception-based question. Why? Because the answer will be at the end of the text. First, they will say this is this, the 1, 2, 3, 4. Responsibility of the nurse. 1, 2, 3, 4. But at the end, they will say, in case needed, if necessary, or something they will say, then they will give you the answer. Do you have the last sentence similar to any option? Second
Yes,
option
Father.
is already eliminated. Now you have first and third option.
It's C, Father. Delegate
Can delegate
responsibility.
responsibility for the compound case to another ward. Here it says the nurse in charge should arrange for the case to be held in a neighboring ward. Another ward is synonymous of neighboring by the nurse in charge. Okay. The second one also says keys are kept together, but here in the text it says keys should be kept separately from the main body of keys. Okay. First one says first supervise the opening of the control tract up over C. The nurse must supervise, but that is not mentioned in the supervising is not mentioned in the text. Okay. So just to show you how the exception-based questions work. Give me one sec. Yeah. Yeah. I'll just take you to a particular slide. Yeah. The structure is this. Okay. Exception-based question. The keys, responsibility of the nurse in charge is the topic sentence. Topic sentence says keys are the responsibility of the nurse in charge. Responsibility 1 may be passed to a registered nurse for doing the duty. Responsibility 2, if the keys go missing, what she should do? 1, 2, 3, change the locks, inform the pharmacy, complete the incident form. Responsibility 3, keep the keys separately from the main body of keys. Responsibility 4, keys should not leave the ward or department. Then at the end, exception. What is exception?
Can delegate to another ward.
Can delegate to
Sorry. Yeah. To be the keys to be held in a neighboring ward by the nurse in charge of that ward. Means it can be delegated. That is the exception. Earlier, all these are the responsibilities. First topic sentence speaks in general about the responsibility of the nurse in charge. Then responsibility 1, responsibility 2, responsibility 3, responsibility 4, then exception. This is the paragraph structure. If you understand this way, every paragraph is going to be very, very easy. Hope you got an idea, right? But we'll be coming back to this type of questions. Just I wanted to tell you there is a structure for the paragraph. Every paragraph has a particular structure. So focus on the paragraph structure. Do you have some more stamina?
Yes, Father.
Yes, Father.
Father.
Yes, Father.
Yeah. My computer is not responding. Sorry. Very simple paragraph you can read. Yeah. Can somebody read this?
Trees are
Trees are
lovely.
lovely. They make oxygen, which is necessary for life. We should all plant one. It could change cities by providing more shade. India is planting trees to replace its old ones.
Yeah, trees are lovely is the topic sentence. Means this paragraph is small paragraph is speaking about the beauty of the trees or the benefits of the trees. Trees are lovely. So why do you say trees are lovely? Why do you say that? So the supporting sentence is because they make oxygen which is
Make
necessary
oxygen.
for life. Okay. Then we should all plant one. What is that? Suggestion. We should. Should is suggestion.
Suggestion.
Recommendation. We should all plant one. It could change cities by providing more shade. What is that?
Fact.
It could change. It's the prediction, speculation about the future, right?
Speculation. Could. Yeah.
That all of you plant one tree each. It could change cities. It could in the future. It's speculation or
Speculation.
prediction. Yeah, speculation about the future. India is planting trees to replace its old ones. What is that?
Action.
Developing sentence. It's an example, right? Evidence given. Example given. Or you say Minnie Jackson is planting already. Why don't you plant? So that is example. So first one, trees are lovely is the topic sentence. Then they make oxygen. We should plant one. All these are supporting sentences. 3 sentences. Then you have developing sentence. It's a small paragraph. See, trees are lovely. They make oxygen, which is necessary for life. We should all plant one. It could change cities by providing more shade. India is planting trees to replace its old ones. This small paragraph. Let's see how to do the analysis. Okay, trees are lovely. What is it?
Opinion.
Opinion. Because if Pavani says trees are lovely, Shanmuga may get angry because maybe there is a tree in the neighboring person and all the leaves are falling into our courtyard and she has to clean it every day. Okay, so she may get angry. So she may say trees are the curse to the life. Okay, but it's an opinion. So it can differ from person to person. They make oxygen. That is fact. It's very, very important for you. Later we will teach you the opinion and fact different language. They make oxygen cannot change from person to person, right? Whoever says it, it's a factual statement, which is necessary for life. What is the function? Benefit. That is the benefit of oxygen. Yeah, trees, yeah, definitely trees. Then we should all plant one is suggestion. It could change cities is speculation. Speculation means speaking about future. By providing more benefit, more shade, that is shade is benefit of trees. Again, India is planting one, that is example, to replace its old ones. The reason is the trees are already old, so they are replacing. So you see small paragraph, but how many functions? If you understand this way, the paragraph and each sentence, that's what you have to do in the initial stages to improve competency. Then it will be very, very easy for you to understand later on. Once you get that analytical mind, when you read, you will understand this far better. Okay. See that small paragraph? Sorry. See that small paragraph? Trees are lovely opinion. They make oxygen is a fact, which is necessary for life benefit. We should all plant one suggestion. It could change cities' prediction or speculation by providing more shared benefit. India is planting trees, example. Which could, I don't know, I can't read it. What is that last? To replace its old ones. That is the reason. Yeah. You'll have to work out some paragraphs in between, whichever you find easy in this way. That will help you. So you have the paragraph sentence structure, topic sentence, which is the main point, supporting sentence, which is explanation, developing sentence, that is evidence or example given, then conclusion. So main point in the topic sentence given, there is a main idea or the gist of the paragraph in the first lines. Then you have explanation. That is supporting sentence. Explains the main idea. Then you have evidence given for the main statement. That is the example. That is illustrates the main idea, which is also known as developing sentence. Okay, it can be something like this. One problem is stated, then reason 1, reason 2, reason 3, reason 4. Earlier we have seen the responsibility of the nurse in charge was mentioned in the topic sentence, then responsibility 1, responsibility 2, responsibility 3. One problem can be mentioned, then solution 1, solution 2, solution 3, solution 4. And one of those solutions will be the answer. Okay. We don't want this detail. So topic sentence is in the beginning of the paragraph. You visualize this as a paragraph. Mahatma Gandhi is the father of our nation. So this paragraph will speak only about Mahatma Gandhi as the father, not about his education, where he was born, about the freedom fight, all those things. But only the paternal qualities of Mahatma Gandhi will be mentioned in this paragraph. Sometimes it can be mentioned in the beginning as well as that can be paraphrased at the end. Mahatma Gandhi is the father of our nation. Then we explain why we call him or respect him as the father. 1, 2, 3, all the points and examples are given. At the end, we say, hence Indians proudly call Mahatma Gandhi as the father of our nation. So same paraphrasing. Okay, other examples, paratypes are not required for you. Okay, we'll stop here. We'll give you some task later. Yes. Anything you want to discuss? Paragraph structure, I'll give you some stars, then we'll go into details here.
Acha, I want to share something.
Yeah, please. 1 second, I'll stop sharing. Okay, so that. Yes.
Because when I saw now the paragraph structure, I remember in my class, my teachers always told me in the assignment, each paragraph there is a topic sentence. You have to write like a topic sentence, supporting sentence. There will be a developing sentence 1, developing sentence 2. Then you have to make a contrast. You have to make a conjunction. So now I remember. So everybody should learn this one.
You'll have to say what study, because many of them have joined after that. In the initially what you spoke, they may not have heard.
Yeah.
Majority may not have heard. Yeah.
Because I studied one nursing course in an international university. So that time, because this is the first time I studied in abroad in the international university. So I don't know about what is their teaching pattern, what is the assignment. It's totally different from India, because there is all the things is assignment. We have to read, we have to find out, we have to write the assignment. So once the assignment started, always my teacher there, your assignment should be like this one. Each paragraph may be 150 to 200 sentence. It should be starting with the topic sentence, and there will be a supporting sentence, and there will be a developing sentence 1, 2, 3. Then there is a contrast, because the topic sentence will be my opinion. Maybe I am suggesting to same like the trees are lovely. That is my opinion. I have to support for that one, but there is other person has different opinion. So there will I have to show the contrast with there are many people, they have different options. So this all I learned from the EduSkills platform. I heard from there, this is a paragraph structure. How do I remember?
If there are some newcomers, Nimi was a former admin for a long time, and she was an active learner here. And she achieved a great success in our OET. Even after passing, she was assisting us. When she started her studies, she had to stay back. We are happy that she is back again with us. Yes.
Yeah, because I believe until now I have some blessings from what I did before. So
yes, she has spent a lot of time and assisted so many people as she was the admin for a very long period. Like we have Shanmuga now. Yes. Anything else you want to ask me or Nimi, you can ask. All these things you should have studied when you did your nursing, yeah, or your medicine. This has to be learned in the high school level. When you start writing essays, when you start write some essays, there should be a structure, right? You can't write anything and everything everywhere. Whatever comes to your brain. So if you thoroughly go through this paragraph structure, that's the best way to find the answers. And there are so many answers later on. We'll show you topic sentence based questions are there. Many of them. Even gist based questions. Both gist based and topic sentence based questions will have answer in the first or second line. So you save a lot of time. Sometimes there will be 2 paragraphs for one question. And your answer is in the first sentence. Why should you read the rest of the thing? If you don't read first sentence properly and understand, you'll be reading the whole paragraph and hunting for the answer. You'll not find it. And if anybody wants to join it from the this one, YouTube live, you can join here for discussion. Okay, next time remember to book your seats. I'm just posting again the Zoom link. And then can admit everybody. Yes. If somebody wants to enter from YouTube to Zoom classroom, you can use the link already posted there. Again, I'm trying to post my system. Sorry, I'm not able to post. The system is not responding. Okay, I posted. Succeeded in posting. Yes. We may close the YouTube live. You can just join for the discussion if you want to. Yes, from EduSkills OET, I have posted the Zoom classroom link. Yeah. If you have any discussions, and you can carry on with your discussions. Maybe 6 o'clock. I'll go for my prayer like last time. If you want to join, 8 o'clock to discuss something, it will be very, very useful. Yeah. Please admit everyone, okay? As of now. When you can carry on with your discussions, maybe 6 o'clock. I'll go for my prayer. Please mute your second instrument. Just lower the sound, that's all. Do not disconnect, no problem. Any other concerns you want to ask me?
Good evening, Father.
Good evening.
Father, I do have a concern regarding Part A. I am not getting how to crack Part A, Father. Sometimes I feel.
Yeah. Yeah, tell me, yes.
Yes, Father.
Now, we will be moving into Part A after the basic training we are giving, because all these things are going to be useful in your Part A, whatever we are teaching you now. This is in general. Will be after paragraph structure. We'll be giving you some tasks and all that, and also introduction. I think I'll send you some small videos. I'll post, and you'll have to go through those things and give me the feedback, okay? Because many are asking questions and they are not sure what is happening, where is happening. So we'll send you small videos of 3-4 minutes, couple of videos, which will give you every aspect about EduSkills training program, how it is to be utilized. Unless you know that, you will not be able to utilize it. You will be confused. And Part A we will deal with, and we have, I think, more than 20 sessions uploaded about Part A, almost all the materials, authentic materials uploaded. You can watch them. We will post it one by one for your practice and we'll teach you. Okay. We'll discuss.
Okay,
Provided
Father.
there
Today's
are, yeah, please.
today's class was very nice. I got to know how to eliminate the two options which are not included in the text, which means two similar options. We can select one of them are the right answer. So this I come to know one absolute we have got.
Yeah, that's good. And we'll be teaching every bit of it. It'll be going to be very, very easy once you go step by step. But the problem is people don't have patience. Now my system is teaching me patience instead of teaching you patience. Hi, maybe I'll have to give you some videos because I don't know. I have to give my laptop for service. How long they will take, I don't know, because I can't go on with this. It's not at all allowing me. Even to initiate the session it takes a lot of time. And anytime it can give permanent trouble during the session. But then I'll guide you through some videos and I'll take up all your concerns, collect as I did today. Then we'll go on. But the problem is this, you see, number of students. Today, if you are 30 here, now other than admins, hardly 24 people are there, 23. And next time, among these 23, 13 will not be there. 10 will be there, some other 15 will come in. Another time, some more 20 will not be there, some other 15 will come in. See, there is no consistency. Looking at the face, I can make out people are not getting it because they have no continuity, no consistency. Tried all my level best to separate full-time batch people and the active members, and everybody claimed I am active, and you can see how many notices I am putting now. For me, it takes hours together to take the active members list and delete the other people. I requested them to please exit and we'll join you in other batch, part-time batch, that people don't want to exit. That's the sort of cooperation people give. And I made separate batch for full-timers, and they won't even see the platform once in a week. What are the notices? And they are full-time learners. So recently I deleted a couple of groups. And those who are in the active group, we can make out there hardly 10 to 15 people active there among 90 or 92. Others are simply there, and names are put, and all those names are not active members. Since you ask them to add the names, they have added. Next, after adding the name, they will never know what's happening here. Then how to teach? Do you have any solutions?
We'll continue with the discussion further. Not as a batch. Just will give main group task. Whoever they want to learn, silently they can learn it from there, and we'll go with the discussion as like we did Kata support.
Yeah, last time we went on the platform. This time, shall we go on Zoom? Earlier it was Zoom. Last time it was either we suggested alternatively we'll have. And if possible, we'll give different materials for practice if available, whichever is available. No?
I don't know Father, how many people will attend Zoom.
No, those who require will happen. It was earlier. It was effective when we did Zoom.
Yeah.
When Jackson was opening it, that was very effective, and there were a good number of people than in the Telegram. Telegram hardly a couple of people. They don't even respond there. Only those who are presenting will be giving thumbs up and all those things. Same or admins. That's what I noticed. But when the Zoom discussion was going on, there were a good number of people who were really, because when they are here, they know they have to be here. Otherwise, in the Telegram, they can be anywhere. Half mind participations will be there. But Zoom at least better, I believe. What do you suggest? Others? At least those who are interested can benefit.
No, Father, it's really harming for a beginners like me, I don't know like
Beginners need not take up this one. Those who can take up, beginners can just attend. Those who are beginners can just attend and learn from them. No? So if it is in Zoom, whenever I am free, I can also join. For example, if you have at 4:30, sometimes I can join as well and explain certain things. Or I find that today you have some problem with some questions, tomorrow I can explain those questions. We need not keep separate sessions because keeping YouTube live connected also, it doesn't matter much.
Okay, but
I thought those who cannot, yeah.
It was so confusing, Father, because keep on last two times because of there is less aspirants, the class got cancelled. So like I don't know how in this 32 members, whoever is like a beginner or advanced people, like whoever like me, like we were desperately waiting, but still I'm really not sure. Last, I think the first session it was about the this elimination things and all. Until somebody told me that it was about the part B, I didn't know because I was still in a part A only. I just started. Those and all bit confusing way to start. Still, how to practice those and all. So
Yeah. Yeah, for which we wanted to give you from introduction, we'll be giving you, but I wanted to confirm the students with a couple of sessions at least. Just by saying they will not come understand, right? So having couple of 2-3 sessions in the initial stage, but at the same time giving them something from concrete, whether it is B or C. That's what I said. Whether it is part A or B or C, or listening or reading or writing or speaking, it's immaterial, provided you practice and understand what we give you. When you reach into a part A, then you will understand. It's going to be very easy for you. Because we'll be telling you about the same hedging words, keywords, and the sequence. And what are the sequence of 4 texts? And how do you identify the keywords connected to the sequence? The headings. Same thing we'll be teaching you. But the problem is this, see, after the cancellation postponing twice, this is the third instance, we have hardly 15 people other than admins and the people. See, for 15 people, 15 of us have to be spending our time for 15 learners. Do you understand? For example, Shanmuga is speaking
of the others, whoever really wanted to give next to like 1 or 2 in next 2 months or 3 months the exam, we are getting affect further because of those.
It's not affected because of others. Means, for example, today you are there, tomorrow you will not be there. Somebody else will come in, and they will be asking different questions. So the training will not go in consistency. See, people don't understand what was taught in the previous session. See, today if we are 15, tomorrow 15 will be there, but among 15, 10 will be new students. Somebody who entered. 5 will be there. Next day again there from the 15, and altogether 20, there will be some 15 or 12. So and after some time, this is our experience. After some time, the batch will stop because there will be 1, 2 or 3 people with me, and sometimes one with me, and we will be confused. Who is the teacher and who is the student?
So, Father, what's the solution for this if it's keep on going?
That's what I'm asking.
As you said,
have to find the solution. You have to find the solution. You are in the batch. You have to see. At least some of them are encouraging others, posting the notice in the subgroups. You can put it, reminding. But then majority, you are just observers. You are not doing anything. Then I have to come and post. I am creating the links and post basic notices. I am preparing and giving you. But you don't even want to repost it or request others to join or remind them or tell them what is happening or tell them you have to do this. They may not know, some of them, what is to be done. Now they are asking what is to be done in the comment space.
Yeah. Even after posting, there is no people those who want to join for the.
Yeah, some are posting. I could see that. The problem is not that we don't want to. The training will not be effective. Then I thought, okay, beginners will make separate. Let me take from the basics. Then I thought, let me beginners and full-timers will have separate. I made all these batches and I've been struggling and sending them messages. They don't respond. Even if I post 10 notices, they won't respond. Then how can I do it? Today, you know, how many are here? Okay, some 20 people, hardly 20. And how many notices I posted, or some of you reposted, how many requests we have sent, or admins sent. No, admins were repeatedly sending. After inviting so many times, more than maybe altogether, it will be more than 100 times notices. We have hardly 20 people. The problem next time, these 20 will not be there. Among these 20, 10 will be there, 10 newcomers will come. And they will say, we don't know anything. And even when we start, that's why I thought 2-3 sessions I'll take in general. As we confirm with the participants, we'll remove all other people and go with whatever the number we have. Then we'll go step by step. Others can learn from YouTube. There are so many sessions, more than 1,000 sessions uploaded. But it's not easy to find out which is one, what, where to, all those details. We'll discuss and find out a solution for it. That will be great. I have my prayer at 6 o'clock. I'll be back in 30 minutes. Those of you who are interested can use the platform and discuss and see what is to be done. That's why these 2 sessions I was teaching only your concerns. Okay, what you are discussing, but how we can find it easier or better.
Thank you, Father.
Okay, I'll get back to you. We can discuss and let me know. Okay.
It's a live need to off.
Yeah, I'll be closing. Only on Zoom, we'll be on Zoom. If anybody wants to join at YouTube Live, you can join using the link. I'll be closing the live in 1 minute.
Father, can I discuss?
Yeah. No, this is not mandatory. I am giving you a chance for you to discuss or do something.